Welcome to the module on personalized drug therapies case studies. In this session, we will explore how precision medicine is applied through real-world examples, demonstrating how personalized drug therapies are revolutionizing patient care across various therapeutic areas. Personalized medicine allows us to tailor drug therapies based on individual genetic, environmental, and lifestyle factors. This approach not only enhances the effectiveness of treatments, but also minimizes the risk of adverse effects. We will delve into detailed case studies that highlight the transformative impact of personalized medicine in clinical practice. Our first case study focuses on oncology, specifically the use of targeted therapy in lung cancer. Consider the case of a patient with non-small cell lung cancer, or NSCLC, who was found to have an EGFR mutation. This genetic mutation was driving the growth of the cancer cells. Instead of using a broad-spectrum chemotherapy regimen, the oncologist prescribed gefitinib, a tyrosine kinase inhibitor specifically designed to target EGFR mutations. This targeted approach led to a dramatic reduction in tumor size and significantly improved the patient's quality of life. This case underscores the importance of genetic profiling and tailoring treatment to the specific genetic abnormalities driving the cancer. Next, we will explore a cardiology case involving personalized therapy for a patient with a genetic predisposition to high cholesterol. A 55-year-old patient with a history of familial hypercholesterolemia underwent genetic testing that revealed a mutation in the LDL receptor gene. Given this genetic information, the healthcare provider initiated treatment with PCSK9 inhibitors, a class of drugs that specifically target the pathway responsible for high cholesterol levels. This personalized approach resulted in a substantial decrease in LDL cholesterol levels, reducing the patient's risk of cardiovascular events and highlighting the value of genetic insights in managing complex conditions. We will also examine a case in psychiatry involving pharmacogenomic testing for antidepressant therapy. A patient diagnosed with major depressive disorder was found to have genetic variations affecting the metabolism of selective serotonin reuptake inhibitors, or SSRIs. Genetic testing revealed that the patient was a poor metabolizer of these medications, which could lead to ineffective treatment and increased side effects. Based on these findings, the clinician adjusted the treatment plan to include a different class of antidepressants, resulting in improved therapeutic outcomes and fewer adverse effects. These case studies illustrate how precision medicine can lead to more effective and individualized treatment plans. By incorporating genetic testing and biomarkers into clinical decision-making, we can significantly enhance the efficacy of drug therapies, tailor treatments to the unique needs of each patient, and improve overall patient outcomes. As you reflect on these examples, consider how you can integrate personalized drug therapies into your practice. Understanding the principles demonstrated in these cases will enable you to apply similar strategies to optimize patient care and advance the field of personalized medicine. Thank you for engaging with this module on personalized drug therapies. Let's continue to harness the power of precision medicine to transform patient care and achieve better health outcomes.